got lost, and thank you very much, the organizers, for providing me an opportunity. I have chosen a little different topic. We surgeons talk about procedures and everything, but there are other issues in the life of a surgeon. As surgeons want to be maybe experts in promoting health of our patients, so we fail to prioritize our own health and that of our doctors. Competence is an essential part of our professional identity. In a 2008 survey of fellows of American College of Surgeons, with 8,000 respondents, nearly 40% gave answers consistent with burnout, depression, and nearly 15% had considered suicide in the last 12 months. These are very alarming figures. Training and practicing surgery are stressful endeavors. Burnout rates among surgeons ranges from 30 to 38%. Burnout among surgeons is significant and concerning issue in the medical field. Surgeons, like many other healthcare professionals, can experience high level of stress and pressure due to the demanding nature of the work. Objective of this presentation was to increase awareness of symptoms and consequences of surgeon stress and burnout. Encourage surgeons to be proactive in their own personal health and habits, and promote leaders of surgery departments and training programs to incorporate supportive workplace environments and stimulate research in these areas. State of mental or physical collapse caused by overwork or stress. And burnout is a state of chronic physical and emotional exhaustion, often accompanied by a feeling of cynicism and detachment from the work. We not very long ago did a study in the Southeast Asia, and we call it a second victim. And this is defined as a healthcare provider involved in an unanticipated adverse patient event who became victimized, in the sense that the provider is traumatized by the event. Extreme sadness was commonest, 50%. This is a study which was conducted in the Southeast Asian region, 7 countries. 35%, felt guilt, and 28% fear, and embarrassment, humiliation was in 22%. And there was depression in 21% of surgeons. Horrified, angered, and denial. These are all symptoms, what we call as a second victim. Surgeons work hard and work for long hours. Although I think lately the training hours have been reduced. Some of the people sitting here who have undergone very, very strenuous training at big institutions in Lahore, 72 hours non-stop working. And they deal with life and death. They make a lot of personal sacrifices and come early and work late, work on nights and weekends, perform high volume procedures, meet multiple simultaneous deadlines, and Still, they never complain. And keep personal problems aside and let it not interfere with their work. There is a fine line separating dedication from overwork. If unchecked, overwork can be counterproductive. Unhealthy behavior or even self-destruction, suffering the patient care. I don't know how many of you know this name. He was a fantastic surgeon from Hammersmith Hospital, London. You know, he wrote a book, Companion to Surgical Studies, if somebody has ever seen this. Ladies and gentlemen, it was such a fantastic book. After his death, for next 50 years, nobody had the courage to bring about the second edition. It was out in 2010. There was so Ian Aird was, one of the best known surgeons in London. And in those days, British television had just started, and his name was strongly implicated on the television. And would you believe, surgeons are generally very robust, but still very sensitive people. And he was a man who committed suicide, and is known to be the biggest loss in the field of surgery in the history of surgery. Now, there are a lot of reasons why surgeons are stressed. The ongoing escalation of malpractice lawsuits, and that's coming in this country as well. The maintenance competency in a rapidly changing specialties, and loss of autonomy associated with hospital-based practice. Society expects a lot from you, and surgeons are trained never to make mistakes. It's unpardonable. Surgeons may be tormented by their own perfectionism, resulting in self-incrimination and lack of forgiveness, and even self-loathing and self-doubt, guilt, and exaggerated sense of responsibility. Perfectionism, it's a vulnerability factor. It can lead to depression, anxiety, burnout, and even suicide. Exaggerated sense of responsibility can lead to self-doubt and guilt. This leads to rigidity, exclusion of relationship, and of self-care. Fear of failure provokes a need for omnipotence, and the impending death of a patient generates anxiety regarding our powerlessness to stop death. There are a lot of symptoms associated with burnout. We surgeons generally try to play them down. There is overwhelming physical and emotional exhaustion, feeling of cynicism and detachment from the job, a sense of ineffectiveness and lack of accomplishment, and over-identification with work to the exclusion of other activities, irritability and hypervigilance. These are all symptoms of burnout. Surgeons can have sleep problems, nightmares, social withdrawal, poor judgment, and professional and personal boundary violations can occur, and further perfectionism and rigidity. And there can be interpersonal conflicts, detachment, difficulty in concentrating, and even psychosexual problems in their life. Surgeons have access to online self-assessment tools now to identify level of stress, but developing educational programs that promote supportive environment. Identify our power versus powerlessness over people, places, things, and situations, and promoting the culture of medicine that value work-life balance. Promoting a culture of medicine that values work-life balance, and most importantly, give ourselves permission to be sick and to accept good medical care. Now, substance abuse is another malady which the surgeon can suffer. You know, they are vulnerable to alcohol and substance abuse like sedatives, cocaine, cannabis, marijuana, benzodiazepines, etc. And rate of abuse are similar to the general population. And the burnout increases the risk of these maladies and potential for patient harm and loss of credentials and licensure, personal and family costs, and will treatment better outcomes than general population.
He has served as professor of gynae
You know,
and
one of the famous
and principal of Amazing Medical College.
William
He has
Foster,
been counselor in CPSP
he was
for
so
more than
overworked,
8 years.
he got inducted
Ladies and gentlemen, please give him a
cocaine
round of applause for
addiction
Professor Muhammad Tayyib to please come.
and eventually died.
I request Professor Dr. Mildred
Healthcare profession will use misuse drugs or
Professor
alcohol
Dr. Arya
at some time during
please
their
come
career.
and accompany
Approximately 10 to 15% healthcare professionals and physicians probably have less amount of stress in their professional practice. So they have about 6 to 8% of physicians. But overall, 14% of alcoholic disorders have been identified in the surgery.
Dr. Muhammad Tayyib, Dr. Mudra Saeed, Dr. Arya Rishi, my friend.
You know, substance abuse in residents is between 10 to 14%. And emergency medicine residents psychiatrists showed the highest rates of substance abuse in the study.
On behalf of the Diamond Council
Marijuana and benzodiazepines and
I
access to
welcome you all
narcotics
on this occasion, and it's a
increases
very
vulnerability.
learning type of event. We
I
learn
know.
mutually from each other,
You know, a
and I
professor of
welcome
anesthesia
and with very
who became an
good
addict
feelings about the senior colleagues who have come
and died of
from Lahore, Dr.
and surgical
Muhammad Tayyib,
residents,
Dr.
by the
Mudra
way, have
Saeed,
the
and
lowest
Dr. Arya Rishi.
rate of
And
substance
this
abuse
shows
except
their
for alcohol.
dedication, their commitment, and their professionalism for their profession. And this
A
is
study of
a very
600 and
wonderful honor to
969
have them here as their
impaired
contribution
physicians,
is very worthy for us. And
you know,
now
revealed that
I
female
continue with the
impaired
program,
physicians tend to
Dr.
be
Amara,
younger
because we are already
and
running
had
short of time.
some medical
So
and
please carry on with
psychiatric
the program.
problems at the time of
Thank you, ma'am.
intake, even
I
in a
am so
medical
proud
college.
to introduce you our next speaker, a young and a promising speaker,
Higher rates of drug
student
and alcohol
from
abuse
Bahawalpur
and
Medical
emergency room
College,
physicians,
Khalid Medical
psychiatrists,
College, Bahawalpur,
you know,
who has come here to present
and
his
physicians in Solo.
Please
The
join
rate
your
of
hands to
drug
welcome
abuse
Mohammed
or
Bilal.
dependence was higher in women surgeons, surprising. You know, 25.6% in a study. And male surgeons, it was virtually half of it. You know, what are the causes? The personality traits such as obsessive compulsive disorders may lead to success in medicine, but may predispose physicians to impairment. You know, substance abuse has early roots in the healthcare professionals' underlying personality or behavior disorder may be unmasked by the stress of his or her profession. Physicians with these abusive habits, more personal and family childhood problems even before entering